COVID-19 has emerged as a unique challenge to the humanity. In India, for curbing the spread of COVID-19, the positive persons were kept isolated in institutional quarantine. The mild and first contact cases were instructed to stay isolated at their homes. For monitoring of patients under quarantine, district administration and state government authorities started using GPS-based app solutions for monitoring whether the persons who have been instructed to stay in quarantine are adhering to the instructions or not. There are three basic issues with the GPS-based apps. First of all, they work only for the smartphone users. Secondly, as per March 2020 data, approximately 55 crore Indian subscribers were still using smart feature phones. Thirdly, an app has to be installed on the smartphone and the user has to keep the location of the device always on, so it requires user intervention. Moreover, there was no centralized quarantine management system available at national level with NDMA for providing insights how quarantine is being handled in different states. So Department of Telecom designed an innovative and indigenous solution, CQAS, that is COVID-19 Quarantine Alert System. The system caters not only to smartphones but also the feature phones, making it a comprehensive solution. There is no user dependency, there is no need to install any app, there is no need to keep the location of the device on. CQAS fetches real-time location from the telecom networks using location-based solution. CQAS was launched on 29th of March 2020. The targets are received from the state governments, which are duly approved by their Home Secretary. The targets are then provisioned in CQAS system. CQAS then calculates the location of the quarantine and creates a geofence, a virtual boundary around the location of the target. Then on periodic basis, location information of the target is calculated from the telecom networks. The two data are compared, and if any quarantine breach is detected by CQAS, automated email alerts are sent to the designated authorities. CQAS also plots the breach data on the National Disaster Management Authority GIS portal. CQAS also plots the data to the state data centers and the SDMA portals using API-based secure connectivity. Till date, CQAS has been utilized by 18 state governments and UT governments, and it has handled 36 lakh targets and generated more than 21 crore breach alerts. CQAS is capable of detecting the switched off and the unreachable targets as well. This is how the data looks like, which one feed goes to the NDMA portal, then the emails are sent to the respective state and UT governments and the local administration, and a secure feed goes to the state data centers. The real-time location of the target which has breached the geofence is also shared with the respective agency. This is how the data looks like on the NDMA GIS portal. CQAS plots the breach data in real time on the National Disaster Management Authority portal. There is a distance and movement wise segregation available under different layers. The repeated offender count is also made available for handling the repeated offenders. And apart from this, CQAS has helped the central government as well as state governments for taking appropriate action and informed decision making. CQAS has also helped the state governments in tracking the migrants for providing timely help and relief to them in terms of food, makeshift shelter and traveling facilities. During second wave of COVID-19 pandemic, the country witnessed outbreak of Delta variant of COVID-19 pandemic with very high mortality rate and decrease in SpO2 level in the patients to a significant drop. The need of medical oxygen rose exponentially in the country, and there was no existing mechanism to track the real-time transportation of medical oxygen supply. So Government of India launched a web and app-based oxygen digital tracking system on 30th of April 2021 to enable real-time tracking of the oxygen movement in the country. The system has been designed by Morth, Mighty and DoT. There were two critical issues with the monitoring of oxygen transportation. Either the trucks were not having fitted GPS, or if they were proprietary in nature without any API or interface. Keeping the core architecture of CQAS intact, a new module was developed in CQAS and API-based connectivity to ODTS was provided to handle the above-mentioned issues. The number of the driver or the helper of the vehicle are made use of, and CQAS fetches a real-time location of the oxygen tankers every 15 minutes and sends it to the ODTS server through API-based connectivity. Through CQAS powered ODTS, more than 37,000 tankers at a peak average of 400 oxygen tankers per day have been monitored till date, carrying 4.6 lakh metric ton medical oxygen supply. The system is functional since last 300 days. State and district wise user IDs have been created for sharing the information about incoming oxygen supply, its quantity and time of arrival. Now let us have a look at the impact of CQAS and how it works. COVID-19 has emerged as a